Okay, good afternoon, everyone, and welcome back from the quick little break. So pleased to bring you to the afternoon session, which we have two lightning talks presentations. So my name is Marcus Basca. I'll be moderating the session this afternoon, and also Hannah Pollard will be on your technical assistance if you have any questions or so. Just a quick reminder as well for myself. So I'm also a member, vice president of the Southern Alberta Health Libraries Association. So I put in the land acknowledgement link in the chat box as well. So this afternoon also there's closed captioning available. The sessions will be recorded, and there's a code of conduct and the link to Padlet, which I do believe Hannah will be putting into the chat box. We're also, so I'm going to start with the two lightning talks. So we'll begin with Robin Parker and then with Megan de Armond. And then following that, we'll have our gold vendor sponsors, BMJ. So we'll hear from Michelle Costa and Mary Ann Riley. So just a quick little reminder of sort of the process. So each speaker will have a 5-minute talk, followed by 2 minutes for questions. And when there's 1 minute to go, the soothing bell will inform you that indeed there's 1 minute left in your talk. So without further ado, we'd like to start with Robin Parker, who will be presenting on the Knowledge Synthesis Interest Group, KSIG. And Robin is the Evidence Synthesis Librarian at Dalhousie University's W.K. Kellogg Health Sciences Library, and indeed one of the co-conveners for the CHLA Knowledge Synthesis Interest Group. So over to you, Robin. I see you've got your slides ready to go. So whenever you're ready, that'd be great.
Yes, thank you. Thank you for that introduction, and thank you for having me here at your virtual meeting. So yes, as mentioned, I am one of the co-conveners of the Knowledge Synthesis Interest Group, which is an interest group of the Canadian Health Libraries Association. And I work at Dalhousie, and Dalhousie is located in Mi'kma'ki, which is the ancestral and unceded territory of the Mi'kmaq. At my work at Dalhousie, I'm also, in addition to my work, I'm also a PhD candidate there, and I'm researching topics related to librarians teaching knowledge synthesis. I have the honor to get to work with Naz Tarabi as my co-convener. I will be stepping down this summer, and Naz will carry on for another year. We have rolling co-convener terms of 2 years. We have terms of reference, and our goals are shared here, which are to share knowledge about knowledge search methods and other related aspects of knowledge syntheses, and to network with individuals and institutions that work in the field of knowledge synthesis. So one way that we look at our membership is who are our list subscribers. And when I last did these slides in September, we had 177 members. I think that's still consistent. And people also can sign up through CHLA, and I'm not sure the numbers that are officially on the books there, but I know that we have 177 that are interested in sharing our communication networks. So we do a number of different things to kind of towards those aims and goals of networking and sharing resources. We have hosted a number of webinars. We do 1 to 2 a year. And the titles of some of the ones in the past few years are seen on the screen, and include things around screening, things about searching. This year we're looking forward to hosting Melissa Rethelson, who will be talking about the Prisma search that was recently published, and that will be happening on March 3rd at noon Eastern time. So if you look out for that notice, your folks are welcome to join for that webinar. We also have journal clubs, 2 to 3 a year, and those are accredited, so people can get CE credits if they put in the application through CHLA. And we've also explored doing a search club, though I think we've only had 1 or 2 of those where people get together and talk about search approaches on a given topic. We have read a number of different types of articles for our journal club. Usually they are around searching. Larry was one of our presenters for a session last spring for the article that they worked on and was published in JCHLA around Indigenous knowledge translation activities. And the most recent one was facilitated by our member Leah Boulos, who talked about her publication that she was co-author on regarding rapid knowledge syntheses during COVID as well. And she talked about her experience working with a large author team and working on that manuscript and facilitating discussion about it. Other things that we've gotten up to in the last year or so is myself and other members of the KSIG did the original draft of the letter that went out on behalf of a number of different associations. The journal editors should seek information specialists as peer reviewers for knowledge synthesis publications. And that was sent out to ICJME and was published in the June 2020 edition of JCHLA and has been published on the MLA blog. We also collaborated with the CHLA Standards Project and helped to support the searches that went on for those standards. In terms of the way that we function as a group, we do have a mailing list, and then internally, the co-conveners also share documents on Google Drive. Those are meeting minutes, recordings of our webinars and reports. We are currently working on a website. It'll be a WordPress through CHLA. And in fact, if anyone has any interest in helping with that or any experience with websites, our working group is looking for people who have some experience, so get in touch. And I think I'm out of time, so this is this last slide that I'll just leave up during questions. That it just is just some of the ways that we communicate through Twitter, through our listserv, and I encourage you to join or follow us to hear about future events that are really open to everyone. You don't have to be a member of any particular association. And also our member meetings happen a couple of times a year, and we try to meet in person or online at the conference in June. And Naz and I have been meeting monthly to keep up our planning. And that's all the updates I wanted to share about KSIG, and I hope that that has sparked some interest, and certainly we're open to having folks join us.
Perfect. Thank you very much, Robin. And yes, certainly very interesting to hear all the work that's undergone with KSIG. So we do have about a couple of minutes now for questions. So if anyone has any questions, if you can, please put them in the chat box. That'd be great. Okay, so I don't see any questions coming in. I think you've elaborated and explained that very clearly, everything on there. Oh, there's just a quick question that's come in. If you can paste the listserv into the chat.
Sure, yeah, I'll do that as the next one starts, or I should be able to do it even here. Make sure I'm going to everyone. Yeah, hopefully that works. If it doesn't, let me know. My email is also robin.parker@dal.ca, and feel free to email me if you need help joining the listserv or any other questions. Thank you.
Okay, perfect. Thanks very much, Robin. So thank you, and we'll now be moving on to our next lightning talk presenter, Megan de Armond, who will be talking to us about building collaborative student systematic review teams. And so Megan is the librarian at the Touro University in Nevada, assistant professor, enjoys teaching evidence-based practice, and is also the library liaison to the College of Medicine Physician Assistant Program and Medical Health Sciences. So I see you've got your slides all set up, Megan, so that's great. So over to you whenever you're ready.
Okay, thank you, Marcus. I just want to say I'm Megan, and I appreciate everyone joining me for my lightning talk today, and just wanted to say thanks to all of the conference organizers and planners for putting together this conference. It's been really great to attend, as well as get a chance to do some presentations. I am the Research and Instruction Librarian at Touro University, Nevada, located in Henderson in the Las Vegas Valley. And I want to acknowledge and honor the indigenous communities of this region. The valley is situated in the traditional homelands of the Southern Paiute people. I'm hoping I'm saying that right. And I'm appreciative of those who have stewarded it for generations. At Touro, I am the liaison to 3 areas: the College of Medicine, we're an osteopathic school, the Physician Assistant Studies, and our Master's in Medical Health Sciences. And today my talk is about building collaborative student systematic review teams. Since the pandemic, interest in research has grown at our institution, and I attribute this to a couple of things. One, I think students have more time or maybe a different kind of time since the pandemic, and are possibly feeling more comfortable reaching out to the library and for assistance via email, chat, and meeting over Zoom. I also think probably the primary reason that students are more interested in research is because the residency applications for osteopaths and allopaths are combined now. And then the other possible reason I was thinking was that the USMLE step 1 has moved to pass-fail, putting an emphasis on other areas, research being one of them. So several faculty and student teams expressed interest in working on systematic reviews, and as a relatively new health sciences librarian, learning not only how to do a systematic review, but also learning how to work collaboratively has been an evolving process, to say the least. So my focus today is on a recently formed diagnostic systematic review team. That there are 6 of us in the team, myself, 3 immunology faculty, and 2 DO students. This was my first, in many respects, it was my first diagnostic systematic review, my first time using the PERD framework. I was unfamiliar with many of the other requirements of this type of systematic review, and was not also familiar with the index or reference tests that were part of the review. So I knew I was going to need to work closely with the team. The immunology faculty had expressed their time was limited due to teaching commitments, and so I was hoping to work with the students. So to develop the search strategy, my main role and part in the beginnings of this, I reached out to the students to meet and discuss further, and quickly realized we were both nervous, and or all 3 of us were nervous and didn't know a lot. Like, a lot of the process was new. They had never done or worked on a systematic review, so at least I had a little background to help with that part of it. But they also were fairly new to the index and reference tests. But their expertise on that side helped me in developing the search strategy, just to review definitions and go over terms. And I was happy to discover that they were eager to participate and work together with me on developing. And this was mentioned earlier in one of the paper conversations, where I was thinking about how this did require a little bit of overtime and working outside of my regular work hours. One of the DO students is on rotation, so her time was very limited. The other DO student is a second year, and so she had a lot more availability. So we had many group meetings, as well as just meeting with the one student whose availability was a little more flexible. I also think something that was mentioned yesterday too, I think by Claire, about not grading. I think that also helped too in creating a kind of comfort level with the students in working together. Not knowing that I wasn't going to be grading them on what they were saying or what knowledge they have. And I've also really worked hard to create a safe space in the library, and a safe, like a comfortable environment, so people can ask questions and don't feel self-conscious. and openly discuss anxieties or concerns about working on the project. And so I realized that we were all feeling sort of rushed to get things done. So we met with the immunologist to get a better idea of the time frame, and then worked out setting up weekly meetings to work on the search strategy, which took a lot more time than I anticipated. I think it was one of the hardest search strategies to develop. It was also a COVID question, which there's a vast amount of information, and it was a new kind of strategy to work on for me and for them. Once we got that search strategy established, the three of us co-created an agenda where we could all ask questions and bring up issues with the immunologists. And I think this was also really important to co-create it and all ask questions to the team together. I realized that the students were much more shy than I felt in front of the immunologist, and maybe more hesitant to ask questions to them. And then we met together to submit to Prospero together, and we met, the students and I met doing that, and also to submit to the journal, and our protocol was accepted with revisions. So we've been working on doing those revisions. And then I've also encouraged the students to apply for some poster presentations, and they were recently accepted to both our research day at Turo and ACOM, the American Association of Colleges of Osteopathic Medicine, to do a poster presentation. So that was also really pleasing for me to help them with their professional development and getting ready for their residencies. So my three takeaways are to kind of slow down and just get to know each other, and work out some regular meetings, address their research anxieties, and maybe share your own. Just having that kind of vulnerability with them, I felt like made it a much more open space. And then making the time for a meeting, which is not always easy, especially right now. So thank you. And that's all I have for now.
Perfect. Thank you very much, Megan. It's very, very interesting to see how that collaboration fit together. So we do have some time for questions. So if anyone has any questions for Megan, if you can please put that in the chat box.
I also have my email here. I'll just put up if anyone wants to email me any questions too. I'm happy to answer questions later or at another time if anything comes up.
Yeah, that's great. I think to put in the email, I don't see any questions coming in, just some comments like that. Oh, there's a question that's coming now from Michael Paris. Do you have an interesting feedback to share from faculty?
Well, the three immunologists haven't been very active in participating. I think they are wanting the students and myself to really run this part of it, but I haven't heard too much feedback from them. I imagine we may as we get closer to finishing the revisions on our protocol. No, I see the question, have you involved any hospital librarians that are at hospitals the residents work at? No, but that would be something that I would like to explore for sure. We have not done that. I'm still new at Turo and trying to get connected with the hospitals where our students are doing their rotations, and also the residents at those hospitals too.
So I know you can see that probably too, but the question, no worries, it's all good. Do you have any preferred technologies that you like to use?
Well, we've been using Zoom for the meetings, which has been working out really great. And it's mostly just me sharing my screen. But our Turo's a JBI affiliated group. So we've been using the JBI the Joanna Briggs Institute methodology for systematic reviews. But other than that, I don't know about any other technologies. Google Sheets. I don't know if you count that as a technology.
Thanks. And there's a question just there, because at the beginning you mentioned that you were relatively new as a health sciences librarian, so whether you felt prepared taking on such comprehensive systematic review work.
Yes and no to that. I had training for JBI in June of 2019, 2 months after I started at Touro, but I was brand new to health sciences librarianship. I had been a metadata librarian in an art library previously. So I was pretty overwhelmed just learning the process and trying to understand it. But I think because I've worked on a few projects and our chief research officer has been sort of a mentor for me at Touro and doing research, that helped me feel like I had at least had people I could reach out to ask questions if things came up where I really wasn't feeling prepared. And I was also comfortable with 2 of the immunologists where I felt like I could ask them questions. But it's definitely a little daunting working on systematic review so soon in this field.
Okay, perfect. Well, thank you again, Megan. There's just a couple of comments like that about, hospitals, some hospitals no longer having librarians, and the need for to collaborate and to support clinical decisions. So thank you again very much for your lightning talk. And now we have we're a few minutes ahead, but I'm just wondering, our next session is to hear from our gold vendor sponsors, Bmj. So I'm just wondering if either Michelle Costa or Mary Ann Riley are on the call yet.
Hi, good afternoon. It's Mary Ann Riley, and I'll be the one presenting.
Perfect, thank you. So yeah, I think if, certainly if you're ready or need a few moments or so, or you can certainly get going, that'd be great.
Okay, let me see if I can share my screen. Good afternoon, everyone. Mary Ann Riley from BMJ. I can share my screen. Excellent.
Yeah, perfect. It's great. There we go.
Wonderful. We'll start from the beginning. I am the BMJ sales representative for the Western US, and I would first like to thank the committee for inviting BMJ here today. It's a pleasure to be here, and it's a pleasure to see many of you. I've seen you at conferences and spoken with you on the phone, so thank you. Today, I'm going to talk about a few of our journals, some free resources that we have for you, and of course, I'm going to share the raffle number with you. I know that's important. So let's get started. I know that a lot of you are familiar with our BMJ COVID-19 hub. It was started in February, and there's a lot of information on there. The website is very easy to get to. It is bmj.com/coronavirus. You're going to find articles from our journals, Gut, Heart, Thorax, Emergency Medicine Journal. You're going to find infographics. I wanted to alert you to something that I saw the other day that I thought might be of interest. In the education section, there's an article called Managing Long-Term Effects of COVID-19. So, when we're battling the pandemic, we know that information is important, and each day brings something new to this pandemic knowledge. So I thought bringing that article to your attention would be of help. The one thing we say about our COVID-19 hub, view, read, please share, because all the information is freely available and it's updated daily. If you're not familiar with Regional Anesthesia and Pain Medicine Journal, it's the official publication of the American Society of Regional Anesthesia and Pain Medicine. It focuses on chronic and interventional pain knowledge from pediatric to geriatric. It's a monthly journal publication of peer-reviewed scientific and clinical studies. And some of the features that I want to go over with you is that you have archive access dating back from the very first issue, 1976. It's also a journal that focuses on new medical knowledge in pain medicine to help avoid the overusage of opioids. And before the pandemic, I know that opioid abuse was probably one of the biggest stories in the news. Article topics, perioperative pain, acute pain, pediatric anesthesia, as well as obstetric anesthesia. And I don't want to forget that the new editor-in-chief is Dr. Brian Seitz, medical director of the acute pain medicine services at Dartmouth Hitchcock Medical Center, which is in New Hampshire. For those institutions that are looking for case-based learning, if you're not familiar with BMJ Case Reports, this journal gives your faculty, students, and staff the opportunity for unlimited submissions. It's a 61% acceptance rate, peer-reviewed. You have indexing, I'll just see my screen in a minute, on Medline, PubMed, CINAHL, and Scopus. You have interactive tools. There are also wonderful templates. If you're looking at your collections, I'd like to invite you to take a look at the BMJ Premier Collection. 39 high-quality medical journals. Within the collection, you're going to have gut, heart, thorax, archives of diseases. You're going, and in childhood, multimedia, podcasts, unlimited archive access for all of the journals starting from the very first publication. And if you're not familiar with a lot of our journals in the Premier Collection, I want to invite you to another free resource. It's BMJ Talk Medicine. I'm inviting you to go to the site, very easy to get to, podcast.bmj.com. It hosts 30 free journal podcasts. You're going to have podcasts from Emergency Medicine Journal, the BMJ. Once again, it's podcast.bmj.com. And we know that people are busy, and I've heard back from several librarians, and they've said to me, Marianne, our people can do a podcast. Okay. BMJ Open Access. Yes, we have open access journals, 20 plus titles. You're going to have peer-reviewed, high-quality journals, a wide range of medical specialties and disciplines. And I wanted to alert you to the, back there, the open access journal, BMJ Open Diabetes and Research and Care Journal. It is the official journal of the American Diabetes Association. It publishes basic science and clinical research related to type 1 and type 2 diabetes and related complications. We also have the Journal of Immunotherapy of Cancer and BMJ Open. I'd be happy to send you a list of all of our open access titles from BMJ. Once again, I would like to thank you for the opportunity to present today. As you can see, we have the raffle code up at the very top, 435. I also want to give you the talk raffle number, which is 209. My contact information is at the bottom of the screen. Please feel free to contact me via email at mariley@bmj.com, or you can call me at 862-214-7867. And if no one has told you, thank you for all the work that you do. I know that many of you are moms and dads and have kids in high school and kids in grade school, and you're working from home and you're trying to get into the library. So thank you for all the work that you've done and that you're doing.